Remember back at the beginning of the coronavirus and everybody's like, what are we even doing here? And one of the things that we did do is just shut down schools. Don't have anybody go to school. Have everybody do remote working. It's, remote online learning. It's going to work out. It's going to be fine. I mean, we really thought that we needed to do that. A bunch of states didn't really do that. They just kind of head down and did their thing. And everybody went, oh, no, they don't care about their citizens. Well, one of the major things that I remember thinking is kids studying from home in front of a computer all day long. Life is tough enough as a teenager, tough enough as like a high schooler or a middle schooler, to all of a sudden you're not going to go see your friends. You're going to have to isolate at home. I mean, really? We did that? Yes, we did. And now we've got a spike in mental and behavioral health crisis. Not shocking, is it? No, I mean, it's to be expected. You rock people's schedules, you rock people's boats, you isolate them socially, especially kids. How about all those kids who are just like, all right, yeah, no school, it's party time. And they run around and steal stuff. I mean, it's not shocking, is it? No. If you're reasonable, you're like, oh, that makes total sense. Kind of saw it coming. It wasn't a hard prediction to make, but here we are now going, oh no, we've got a behavioral and health crisis. And it's terrible for those kids who are feeling just like, oh my word, this isn't worth it. I want to end it all. Those are thoughts that are out there, and they're out there in elevated numbers right now because of what happened in the way we handled COVID. So data from the CDC and the U.S. Preventative Services Task Force points to a spike in suicide rates and anxiety among teens. King County faces mental and behavioral health crisis. How many crises do we have going on right now? I mean, you've got the gun violence crisis. You've got the catalytic converter being stolen crisis. You got not enough police crisis. You've got the southern border crisis. I mean, you've got Ukraine, Russia. You've got the midterm elections crisis if you're a Democrat. I mean, that's something to be worried about if you're a Democrat. That's not going to go well. You got the crisis of a Trump going to run again. So many crises to be, and I probably, omitted a bunch of really important ones that I'll be like, oh, why didn't I say that? Well, because you're a moron. And that's just what we're doing. So let's jump on into this one. Before I do, if you're new here, welcome. My name is Sean Reynolds. I own a couple of real estate companies. I read the news. That's what we're doing. Okay, let's get to it. There's a mental and behavioral health crisis in King County schools, prompting the expansion of a program designed to address counseling and care for students in need. I got to be honest, at the beginning of the coronavirus, I wasn't even really self-isolating. I still came to work. We did the whole 6 feet. I'm in an office. Other people are in different parts of the office. I got to see people. But if I wasn't able to see people, like if I was a teenager and all of a sudden, you're going to stay at home forever, or until the 15 days to slow the curve. It went like for a year or something, didn't it? Yeah. Huh. Interesting, right? As an adult, as a semi-well-adjusted adult, I had a hard time. I was like, this sucks. I can't go to a restaurant. I can't go to a concert. I can't do my normal stuff. My gym is closed. I had a meltdown on the gym. Well, until I found a gym that might have, been owned by a patriot and open during the coronavirus. So there's that, that kind of stuff. But to have to do that, and then you go to the gym and you think, God, am I going to get COVID and everybody's going to, laugh at me? No. But I did get COVID later, and I'm sure some people laughed at me. You got it. I mean, that's kind of just how we did it, right? I didn't die. Well, all right. I mean, just everybody's had it now, right? It could not be more clear that we have a crisis in behavioral health, mental health in our youth. It shows up routinely, shows up in many ways. It shows up in things as terrible as kids taking their own lives. That is horrible. Like as a parent, you get a kid to like age 18 and you think, fly, little bird, fly out of the nest. And then they take themselves out. Absolutely horrible. I mean, just game stopper, right? I mean, that's terrible. It shows up in what we're hearing from staff at school districts, what they see every day, and we need to act, said Leo Flor, the King County Department of Community and Human Services Director. How much would this be different if we just kind of handled things in a different way? We didn't have everybody go home all the time. We figured out something different. How much would, our schools that didn't do this, that didn't shut down, or maybe, didn't shut down for as long as Washington State did. I think Washington State was one of the states with, the way that we lean politically. It's like, be very afraid, go home, be afraid, isolate. Yeah. I mean, what are other states doing? I'm not sure. I just know that King County, specifically, and it's the biggest county in Washington State, they're having troubles, tough times. So his office points to data from the CDC and U.S. Preventative Services Task Force, which points to a spike in suicide rates and anxiety among teens. Being a teenager is hard enough, right? I mean, you got that whole peer pressure. Don't do drugs, they're great. Go to a rave, take drugs. That whole thing. Have sex, don't have sex. Am I going to be happy? Am I going to be successful? What college do I go to? What outfit do I wear today? I'm too fat. I'm too skinny. I'm not buff enough. I'm not pretty enough. My boobs aren't big enough. All those things. Any one of those things could just send you spinning. And you take all that on top of, all right, yeah, that peer group that you used to be around, kind of your support system. Just cut that off at the knees and see how it works out. And then spend all your day behind a computer going, oh God, this is incredibly difficult and or boring. That's what I always kind of thought of learning. I like learning as an adult. I like learning stuff that I want to learn. Sometimes you don't get paid for that. Sometimes you do. It's weird. But just sitting there, all right, you got to learn English. You got to learn math. You got to learn history. All good things as an adult. Learn as much as you can as a kid and topics you don't like, because you might circle back to that stuff and go, oh, sure glad I took that. And that's what a lot of my schooling has been. I'm a college dropout. Made it halfway through my junior year at the University of Washington with a political science degree, was going to go on to become an attorney. And then I thought, you know what? I don't really need this degree. And I was right, but it would have been handy to have so many conversations. So what school did you graduate from? Well, I didn't. You're a dropout. Yep. It would have been nice to say, I've got a 4-year degree. But then there's also kind of this thing, guys my age, that if you could make it, you had that extra head start by not doing the school thing. And I think there is a certain aspect to that. I'm in real estate. You don't need a college degree for that. You just go. And if you're good enough, you'll make it. If you're not, well, then you might want that college degree to fall back on, right? So there's that. King County using $16.4 million in property taxes from the Best Start for Kids levy, and the MIDD behavioral health sales tax has funded what is in short called the SBIRT assessment to diagnose student needs. Kids in middle schools in 11 different districts have taken a confidential survey on their mental health, and districts have been allocated money for care. Kids' minds are blown. I didn't pay as much attention as I probably should to how that impacted kids, because my kids are older and, they're semi-adult, like, age 29 and age 26. They're getting there, right? They're getting there, because majority of you are either my age or older, maybe a little bit younger. When we were 25, I feel like when I was 25, I had at least one kid, was thinking about another one. And I was like, all right, this is go time. If I don't work, my family doesn't eat. That's not going to be good. My wife didn't work. I wanted to do that stay home from, working thing if we could. And we always did that. And that was important to have my kid's mom be at home with them. I thought that was really important. That's how I was raised. Yeah. So we went down that road. So if I didn't work in my mid-20s, I wasn't off just goofing around, just kind of hanging out. Jobs are easy to come by. I feel like a lot of other people of my generation probably one of the last generations to kind of have that work ethic. There are kids out there doing the same damn thing right now. It just seems like they're far and few between because of computers and, well, I just made $50 million in the stock market. I'm going to take off 6 years and go travel the world. You hear that stuff and you're like, okay, well, that wasn't exactly my path, but good for you. And good luck with that. So since the program, they've got this program going, nearly 4,000 students countywide have been referred service because they're melting down. The county has now issued grants for high schools in 13 school districts and at 1 private school for the 2022-23 school year. So we've got all these, they're basically enhanced programs for 10 to 13-year-olds who are visiting emergency rooms for suspected suicide attempts. So this is based on hard data. We've got a whole bunch of kids who are like, yeah, we're not handling this all that well. We've been impacted and we've got these thoughts going on and this is horrible. And that's kind of the situation, we're at. I think there are a lot of other instances of things that we're going to find out from the pandemic. Maybe we should have handled things just a scooch differently. It's been really hard to be home during the pandemic. When asked about the increase in cases, noting that the whatever agency allows the district to identify students that need additional support and allocate resources specialists accordingly. Especially around social media, a lot of students respond that most of their community was built on social media, and then there's bullying on social media. The whole bullying thing, it's just terrible. What do you even say there? Don't bully each other, but it's going to happen. It's like, don't start a war. Well, mankind's history is based on war, isn't it? It's always based on one person getting the upper hand, stomping somebody else. Doesn't have to be that way, but it is. So we're probably always going to have it. Don't have any great solutions there. But yeah, we've got a little more than 1,100 students have been tested using whatever, and 20% screened red, meaning they had suicidal agitation or self-harm tendencies, and 20 to 30% screened yellow for anxiety or depression. I probably fit into the anxiety and just kind of depressed during the pandemic. It's gotten better since then. But it was like, this is really effing depressing. Our life is just kind of been put on hold. And when you're a kid, a teenager, early adult, you don't have the skills to be able to tell yourself mentally, all right, I'm going to make it through this because I've made it through all these other things in my life, whether it's getting fired, losing a job, divorce, relationship going sideways, losing a parent, any one of those crazy things can just kind of put you in a tailspin. But kids don't have that ability. They don't have that history of life to kind of look back and go, okay, yeah, that was horrible, but I made it out of that one. I can make it out of this one. So, feeling anxious or depression, yeah, not good. So public service notice here, National Suicide Prevention Lifeline at 800-273-8255. That's what you call. That's what you're supposed to call if you're not feeling good about the way things are going. Sometimes that doesn't work, but it's one of those things that is out there and everybody should know. All right. And those folks can and do have the ability to talk you down. Had a friend that worked at basically a crisis intervention hotline. And, a lot of times just talking to somebody else, you can kind of work out, all right, this isn't nearly as bad as I thought it was. Okay. This too shall pass. That's what I'm going to leave you with on this one. This too shall pass. That's the way life typically goes. Sometimes you get your boat rocked and it's something major, but most of the stuff that we get really worked up about, in the end, yeah, it's kind of important. But you work your way through, you get on the other side, you keep motoring on down the road. Thanks for being here. We'll catch up soon. Talk then. Bye for now.